Obviously, I want to talk about the NHS, but I did just want to get your response to the story that we're leading with this morning on the war in Ukraine, because President Putin's come out saying, we're not planning to go to war with Europe, but if Europe suddenly wants to fight and start, we're ready right now. There can be no doubt about that. I mean, are we ready for a war with Russia?
Well, firstly, I think we should see this for what it is, which is the same old sabre-rattling we've heard from President Putin, and the irony of President Putin talking about warmongering on the part of European leaders would be laughable if what he's doing in Ukraine weren't so serious. This is a man who launched an unprovoked and unwarranted invasion of a neighbouring European country without any justification, who has not only inflicted the suffering and losses that we've seen on the Ukrainian side, but has led to over 1 million of his own people as casualties of a war that he caused. So look, we do take the threat from Russia seriously. Both in terms of not just how they're conducting the war in Ukraine, but their broader threat to European defence and security and to British national security.
This is the question, though. Like, are we taking it seriously? Because, we had the Defence Select Committee report saying, we're frankly not ready at all, for it. We've got Yvette Cooper announcing £10 million today for energy repairs in Ukraine. I mean, it sounds pretty small fry when you've got the president of Russia, who is, let's be honest, kind of a megalomaniac, saying he's ready for war.
Well, it is fair to say that, as with many other things, we inherited our armed forces in a condition that we would rather not have received. I think the Conservatives did not do with the defence and security of the nation as they should have done. And frankly, what we are doing, which is prioritising defence, and we are prioritising investment in defence. You've seen that across the successive budgets and the spending review by the Chancellor. She's got, as we saw at the budget, a range of choices and trade-offs to face. The one thing she is not trading off is Britain's defence and security. Okay. We are prioritising, we are investing more. That makes some of the other choices we want to make harder as a result, but I think the first responsibility of any government is the defence of the nation. We're investing in defence, investing in our armed forces, and crucially, the Prime Minister is investing in the relationships and the alliances internationally that safeguard Britain's national security, European continental security, and the security of Ukraine.
Let's talk about the health of the nation as well, shall we? So you're pushing for more online appointments for GPs. So the idea is kind of, to stop that mad rush, I guess, at 7:59 a.m. when you're really stressed out about not making it for the 8 a.m. release of appointments. The British Medical Association are opposing it, though. They're saying, patients will be put at risk if they can't get through on the phone or in person. And
it's so disappointing because this should be a really good news story for general practice. We insisted through the contract negotiations with the BMA, which, by the way, they signed up to, and the chair of the committee has since had to backpedal because she apparently didn't read the contract closely enough, but they signed up to this. And what frustrates me is you would think from the BMA that I've had to drag GPs kicking and screaming to provide something that most services now provide, which is online access in the 21st century. In fact, it's been the opposite. GPs have responded, they're up for it. 98.7% of practices are now delivering online access. This should be a really great news story. When we came to office, satisfaction with access to general practice was around 60%. It's now 75%. Now, I'm not satisfied still because that means 1 in 4 people are not yet satisfied. But that's a remarkable improvement in the space of a year. And GPs deserve real credit for that. And their own representatives are far from saying, isn't it great? Look at what our members have done. Look at the modernisation. Look at the improvement in patient satisfaction. They are, sat in the corner like moaning minnies when actually their members are doing a really good job working with the government to improve patient care and experience.
I mean, it sounds like you've really kind of had it with the doctors' unions.
With the BMA, certainly. I mean, whether it's the rhetoric and the behaviour of the BMA around general practice, whether it is yet another round of unnecessary strike action being proposed by resident doctors who've had a 28.9% pay rise, we've seen an outbreak in the British Medical Association of juvenile delinquency. And it is irresponsible because We know that the NHS is under real pressure. We'll talk about that in a moment in terms of urgent and emergency care and the situation we're seeing on corridors in hospitals, which are wholly unacceptable. And yet, since we came to office, there are real signs of green shoots of recovery, whether that's on the waiting list, whether that's on patient satisfaction with general practice, whether that is the investment we're putting into urgent emergency care. We could be leaning into this together. Instead, the BMA is not only holding back the NHS's recovery and inflicting damage on patients, it's also self-defeating for their members who are having to work in these conditions.
So I guess my question is, were you a bit naive when you went into some of your dealings with, the BMA, with some of the resident doctors' unions? I kind of felt like, paying them that big increase when you first got in was supposed to stop strikes, and there was all this stuff about, the Conservatives just need to get around the table with them. I mean, it feels like you got into office and thought, actually, you know what, it's a bit harder than I thought it was going to be.
Well, the reason we took that action with resident doctors within the first weeks that we came into office, because I thought it was the right thing to do. And actually, part of my frustration with the Resident Doctors Committee of the BMA is when they raise a whole range of issues that resident doctors are concerned about, they're not having to do so against a health secretary or a government that is resistant or disagrees with them. There are a whole bunch of things about their pay, their career progression, training places, bottlenecks, international medical recruitment, where we are in agreement. But change takes time, and they've got a willing partner, and they need to work with us rather than against us.
How worried are you about the impact of these strikes in December?
Right, so,
we've been talking about the corridor care, of course.
Yeah, I'm glad you asked, because look, the last 2 rounds of strike action, I think, have been managed really well by NHS leaders, and I'm so grateful to frontline staff who've helped us get through it. In fact, the last round of strike action, we managed to maintain 95% of planned care to cut waiting lists, which is brilliant, actually, by historic comparisons. However, striking just before Christmas in the way that's proposed is a different order of magnitude of risk, which is why I think it is particularly irresponsible and it's unnecessary.
People are going to die, is that what you're saying? Lives are at risk.
Well, I don't want to sound catastrophic about it, but it is a different order of magnitude of risk, and I am genuinely worried. And you can see from what Jim Mackey, the Chief Executive of the NHS, said yesterday in terms of the strength of his statement and what we're hearing from other clinical leaders, they are also fearful. So it's not too late to avert that strike action. The one thing I'm holding on to, and let me take him at his word, the chair of the Resident Doctors Committee has said it is not too late to call off this strike action. So let's see in the coming days if we can find a way to do that. I can't go further on pay this year. They've had a 28.9% pay rise. We do want to work on jobs, specialty training places, and to deal with the issue of international medical graduates and the extent to which our homegrown talent are competing on equal terms with overseas applicants. I want to deal with that. It takes time, changes of law, but let's see if we can work together.
I've got one more question I'd like to squeeze in, because we're going to be seeing a bit more from Angela Rayner today, right? She's been pretty quiet since her resignation, but she's going to intervene on the workers' rights bill. She says it needs to be sped up. That was obviously her kind of like baby, if you like, in government. Do you agree with Angela Rayner on this?
Well, look, we've ended up in a situation where the House of Lords have been blocking a number of aspects of Labour's employment rights bill, which, by the way, includes the Green Party, who talk a good game when Zach Polanski's on the airways, but their actual legislators in Parliament are doing something else.
Do you agree with Angela Rayner?
But I think what she's trying to put forward is a part of a compromise of saying, OK, if we can't do everything in the way that was planned, can we do some of it faster? I'm not close enough to the detail as to whether that's feasible, but I understand what it is she's driving at. And she's respected enormously for her work in this area, and I know ministers will want to work with her.
Yeah. Would you like to see her back on the front line soon?
Yeah, yes. I mean, today's shows. I mean, she's hardly gone, has she? So, but the words "quiet" and Angela Rayner rarely appear in the same sentence. So, and look, just remember, she made a mistake, but it was an honest mistake. I think she's still got a lot to contribute.